Hi guys, Dr. Ladner here, and today's topic is managing patient expectations and how I do that. So first of all, I'm just going to get this out of the way. I don't manage expectations. I actually feel like that's really a terrible term. How can I possibly manage someone's expectations? I think there's a different and better way to look at it. So first, I am going to go through at the time of the consult what patients should expect with their procedure. And that's going to include the day of the procedure, the anesthesia, the recovery, the time scale for how long it takes to recover, what they should expect at the end, side effects, possible complications, etc. So I'm going to go through all of those expectations based on doing this for 15 years in my own practice. What I need to do a good job of, and patients also need to do a good job of, is making sure that what I've told them fits with what they're thinking. So if we're not a good fit for each other, if I'm not the appropriate surgeon for them, then we shouldn't go through with the surgery. And likewise, if a patient is not the appropriate fit for my model, then I'm going to advise them that perhaps they seek a second consultation, right? Or maybe reconsider what they think they might get out of this procedure if it sounds a little bit unachievable. So I would put the spin on it as not trying to manage people's expectations, because those expectations really kind of are what they are. But I'm going to go through what they truly should expect. And if that is consistent with what they're hoping for and what they want to achieve, then it's likely going to be a good fit and we're going to have a good outcome. And that's it for today's teaching.